Welcome to our webinar today. It's going to be myself and Ray presenting, and we're going to be talking about community leading training, and Ray's going to be talking about the community leadership training program that we've developed. So Ray is working with BVSC on this, and this is a collaboration between Birmingham City Council and BVSC. At any time, if you want to have a look at some of the webinars that we've got coming up for Black History Month, I have popped something in the chat. For those that have joined after I popped it in the chat, I can pop it in again after the recordings. We've been running webinars all throughout October, so there's recordings that will be on our Healthy Brum YouTube channel, and also this recording from today's session will be on as well. So the agenda in terms of what we're going to be doing today, I'll be introducing communities and community leading, talking about how communities are defined from a health aspect, and the importance of community leading for public health. Ray will then be talking about the community leadership training and the early evaluation at this stage. And he also will promote some of the upcoming events that we've got in place should you want to attend any of the in-person sessions. We also do have the community leadership training as e-learning modules for people to access, and Ray will talk about that later on. So we will be using Menti today. For those of you that haven't used Menti before, it's an interactive tool, allows people to jump in and talk to the slides. If people can go on to www.menti.com, and the code for today is 27530868. I'll probably leave that up for 10 or 15 seconds or so, just so that people can make a note of that and can access Menti. Perfect, that should be enough time. Cool. So the first part of this is talking about communities and community leading from a public health perspective. So myself, Joe Merriman, I'm a public health senior officer within the communities team. Been heavily involved with collection of community health profiles that we've developed within the team, as well as working with community engagement partners as well. Some of the other work that the communities team does as well is arts and health. We're involved with the Birmingham and Lewisham African and Caribbean Health Inequalities Review, or BLACKEAR for short. And we've got some projects like the community leadership training that we're running with BVSC. So the first Menti question, I can see it's loading in the top. It would be good to find out how people define themselves or defined their role within their community. So if people can add on Menti, what community or communities do you belong to? I'm going to leave that really open spec so people can jump in with however they see fit. And if people can put that in the chat, and I'll go into some definitions of communities from NICE guidelines and some other definitions as well. I can see the person in the right-hand corner. So if people, when people start submitting their answers, I can see that coming in. Perfect. So yep, belonging to a faith community would definitely fall into the definition of a community. Just going to give it 30 more seconds. Local neighbourhood, definitely that would fall into definition. Global majority community, yep, definitely. Just going to give it 30 more seconds. Global majority again, great. Community of Birmingham, communities of particular interests, and for that individual, somebody who's from the Black community. Hobbies, brilliant. As you can see from those answers, quite a varied kind of pool of answer. You can see that communities really are how people define themselves. There's no kind of set things that people define themselves as community, and I think it's important to respect that. There are different communities that people identify as, and also a lot of these communities will overlap with one another as well. So in terms of communities, with definitions, NICE have defined characteristics of a community as you can either be from a geographical location, through race and ethnicity, through age, occupation, having a shared interest or affinity. Religion and faith could fall into that, but also hobbies could fall into that as well. People who are socially isolated, and other common bonds such as a health need or disadvantage. The King's Fund, which has done a lot of work into inequalities and communities, has defined a community as groups with a particular health need, a group receiving similar health services, or people who help to shape or provide services. So that's in the context of health and care. As you can see, characteristics of a community are quite wide-ranging, and you can fall into many different communities at the same time. In terms of the role of the communities, we know that the role has grown in recent years. Communities also know how best to tackle their health inequalities that they experience. It's really important to make sure that communities are involved throughout the decision-making process in terms of where community activity to address health inequalities should exist, how it should exist, and how it should fit best into those communities. The other thing that's really important to point out as well is sometimes the reality within the community is different from the data available. The communities team set of community health profiles are probably quite a good evidence for that. The community may know a more true picture or more accurate picture of what's going on within the community. It shows a real emphasis to make sure that we're engaging with the community successfully, and also listening to the community in terms of some of the feedback that they're giving as well. This is a model from the King's Fund that talks about approaches to involving communities within healthcare. So we can involve communities at a service-focused level in terms of communities in pathways of care, helping to expand the scope of services that the health system is able to provide. It's also important, as I said previously, to include communities and within service design. But we can also look to do more community-focused work. We can look at community development, so helping to strengthen communities so that they can improve their own health and well-being. And that angle of empowerment is really important, particularly around community leadership and using community advocates. But also community commissioning, so helping to give communities greater control over the commissioning of services that they receive. It's really important at that stage to look at needs assessments and focus groups to make sure that communities are having a say into the services within healthcare, to make sure that they're fit within different community groups. In terms of community development, again, the King's Fund has suggested a few different methods of community development. Those can include asset-based models, helping to strengthen social relationships, social movements for health, whether that's whole, local, regional or national approaches, and you'll find that you can get different benefits whether you go local, regional or national. And the final one around volunteering and community leading, we saw this was a real key success during COVID. The emergence of community COVID champions that helped to escalate some of the information around COVID, but also there was a lot of volunteer work done around COVID, whether that was with testing sites or helping people to receive some of the supplies that they could have in their own homes, helping people with shopping and things like that. So a definition of community leader, the local trust has identified a community leader as one that speaks for their community, but they're not necessarily formally appointed. Community leaders can be leaders of place, interest or solidarity. I think as well, with the definitions that we have of community leaders, basically a community leader can be a leader of any community. So all of those definitions that we had previously, ones around faith, age, occupation and hobbies, for example, you can be a community leader of any of those. Because there's not a formally appointed community leader, you'll find that people can identify as community leaders, and people can be recognised as community leaders as well. They tend to emerge organically, so they emerge through demonstrating their relationships with people, That can include people within their own community, but also having the influence to be able to persuade other communities and the ability to persuade other people and services to achieve the things that they want to achieve for their community. Can be a really good focal point for us in public health to make sure that we understand what we can do to help support the community, but they can also be important for helping the community to voice what they need to voice back to public health as well. So helping with that bi-directional relationship between the two. You hear from the Local Government Association of the role of a community leader. So they help to stimulate local organisations and individuals to take up opportunities to express their views. They represent local level concerns and perspectives. As I said, maintaining a link between the users and the providers of services, so that link can be both way. We can help to inform the community leaders, but community leaders can also help to inform public health. Encouraging the community to organise for themselves goes back to the whole notion around empowerment and making sure that community are able to support themselves and address their own health and well-being, as well as getting support from health services, including public health. Working with other community leaders in the voluntary community and business sectors, you can find that a collection or a network of community leaders can be really important for helping to address problems that overlap throughout multiple communities, but within the same community as well. They help to offer vision and direction to local groups and building support for that vision, and they help to broker agreements between different interests and partners. And they contribute as an effective partner in neighbourhood arrangements, including those that deliver delegated functions. So next Menti question that's just loading now. What would you all say makes a good community leader? You've heard some examples there. What would you say? Is there anything missing in terms of what makes a good community leader? Are there any skills that you yourself as a community leader that you think are important, or any work that you've seen community leaders do that you think is a really good example of good community leader? An advocate, great. Tend to see those terms leader and advocate used quite interchangeably. Brilliant. Starting to see this word cloud. Passionate is a really good, important one. I don't think that was captured before. Genuine and trustworthy, really important to make sure that community leaders are able to speak for their community, but also that any actions that they say that they'll take up, that they will follow up on that as well. Really helps to show that they're trustworthy, bringing people together, carrying everyone along, kind and open-minded as well. Some really good examples in there. That's great. Perfect. So in terms of the importance of community leadership, they can be essential for tackling and addressing health inequalities. They build relationships with local organisations and communities. There's a commitment to community engagement and empowerment, supporting with responses to local priorities. Community asset mapping can be really important with that. Definitely when services are being delivered or developed, community leaders can help to prioritise where community assets are in place, and to make sure that we're making the most of some of the community activity that's going on already. Building an understanding of the local community and the needs of local communities is really important. Improving access of people in the local community to influence and shape public health. I think that one's really important. We know, for example, that sometimes we don't reach some of the communities that we would like to reach. And it's really important community leaders can come in and help those seldom heard voices to have a voice and be able to influence and shape public health. And it supports bi-directional dialogue between key people in the local community and influential public health decision makers. Not just public health, community leaders can go into any health setting or business, and they can help to shape and influence those decision makers. Brilliant. The other thing around community leading is that it has shown as a real key driver for things that can be tackled to help to reduce health inequalities experienced by Black African and Black Caribbean citizens living in Birmingham and Lewisham. So the Birmingham and Lewisham African Caribbean Health Inequalities Review, or BLACKYEAR, was one that was conducted around last year, where there were rapid evidence reviews completed under a number of different topic areas. And the idea was to find out some of the health inequalities experienced by Black African and Black Caribbean citizens, but also to develop opportunities for action. So opportunities that local services, whether that's integrated care systems, NHS, local authority, local third sector organisations can address to help to improve or reduce health inequalities within Black African and Black Caribbean citizens. One of these has read a team of community advocates who understand the needs and barriers for Black African and Black Caribbean communities, supporting them to navigate and access support, such as social prescribing. So Ray will be talking about the community leadership training following this slide, and we have had a number of Black African and Black Caribbean citizens who have undergone the community leadership training. So we have this project that Ray will be talking about has helped to fulfill one of those opportunities for action in making sure that we are giving opportunities for community advocates to better understand the needs and barriers of their communities and supporting them to navigate and access support. Ray will touch on it as well. We still will have online e-learning, so we can keep this going as a legacy of the project, and we can help ensure that we're continuing the development of Black African and Black Caribbean community members as community leaders. Perfect. I'll move on to the next slide, which is a Menti slide. So just a quick one to assess before Ray goes into his slides. Have people within this webinar heard of the community leadership training? And if not, then it would definitely be useful to share within that. So a couple of people are saying yes, they have, but they haven't attended. A few people still haven't heard of it. So as a consequence of this webinar, if people can share some information about the community leadership training, we'll be following up with the information from the slides. But if people know of people that are community leading and feel that they can improve their skills as a community leader, that would be a really good to do this after this webinar. Perfect. I think people can still answer even if I move on to the next slide. So I'll move on to the next one. Perfect. I will now pass over to Ray, who will be going through the findings that we found so far and talking about some upcoming events that we have for the training.
Okay. Joe, thanks very much for that introduction. And just before I go any further, I had a little bit of a problem a moment ago where it seems as if I got thrown out of the actual webinar, but hopefully we won't get a repeat of that. For those who don't know me, my name's Ray Walker, and I'm an independent consultant, but work closely supporting Birmingham Voluntary Services on a number of activities, including the Community Leadership Training Programme. If we can have the next slide, please. So BVSC was obviously successful in bidding for the work that was put out there by the public health team to actually deliver a training program, develop and deliver a program of training to help community champions and leaders. And there are several aims in relation to that, to help them to deepen their understanding of community organising, to develop core community organising leadership skills, one-to-one relationships, storytelling power of analysis, campaign strategy. I'll go into that a little later on in terms of demonstrating the modules that we covered. But it's quite a wide-ranging subject matter that we provided for the participants. But the aim was ultimately to equip people to lead change in their community. And in doing that, it was very much done in a way to actually try and do what we're doing and try and make it as bespoke as possible to the actual participants. We were tasked with getting 150 people to benefit from the training. We've exceeded that, as I'll explain later on. And the other aim as well was to, again, promote to those who had already started to do champion and leadership work in their communities around the Boulder Health Champions, for example. So again, one of the areas and people we were targeting with those who had already were community champions in order to build their skills and knowledge as well. Thanks, Joe. So in our bid, and I think the reason why we were successful was that we aimed to actually develop a modular and a mixed mode of training delivery in order to actually try and get to as many people as possible, to make it as convenient and accessible as possible. So we had face-to-face training, we had bespoke delivery. For example, we not only did sort of 2-day straight running, 2-day programs of the delivery, but we also, having spoken to particular groups we were working with, tried to do it around their convenience. So in some cases, the clients, I can think of one particular group, they wanted a more elongated program, which we did over 4 weeks, 1 day a week. That suited them. There was childcare responsibilities. So again, we tried to spec it in such a way that actually they would be able to go on the program and then go off and get kids on time from school and stuff like that. So we tried to, as I say, bespoke it as much as possible. We did an online delivery program around a webinar similar to what we're doing here now. And as I'll show later on, we developed an e-learning platform for delivery as well, which has proven to be very successful. We believe we could go well beyond the 150, which we've done, and therefore we were looking ourselves to try and get up to around about 300. And what we also did was to obviously try and engage as many potential participants possible through our own marketing at BVSC and various communications channels that we have, as well as the City Council's public health contacts and approaches for getting the programme out there. Thanks, Joe. So what actually happened? So in numerical terms, just to give you a broad flavour of the programme, the delivery was by 7 trainers, and myself included, with a range of expertise and knowledge and experience. And we also did some co-delivery as well. So in some cases, what we were able to do was to have the trainer there, but with somebody who very much were linked into the community as well. That was very much one of our big intentions, is to make sure this wasn't just sort of doing it from a sort of theoretical level, but was doing it from the point of view of people who actually had real experience of working with communities and for communities. So we planned for 14 2-day training sessions with at least a capacity for 210 learners. In the end, we actually delivered 7 2-day training programs, which 33 people attended those training sessions. We delivered 2 times 4-day sessions online with 6 people who attended that. And we delivered a 4-day bespoke program with Sports Birmingham, who one of our people we sort of linked up with to try and access the actual program. And as I say, we actually delivered and developed an e-learning platform, of which we, at the time of when we put this together, we had 161 registrations. We've exceeded that. I think we're near the 200 mark now, easily. So we are somewhere in the region of the 300. We had 300 actually registered in person for the actual online training. We didn't convert all of those for online training. I think what was really interesting is that whilst people got to know about it and actually were able to actually register for it, very often there were people who did drop out, unfortunately. And I think what that was synonymous of is the fact that many people in the sector were committed to training, but I think the pressures of work that they're doing in their organisations was such that sometimes at the last moment they had to drop out. They're very apologetic about it, but I think that's one of the sort of byproducts that we saw coming out of this, was the way in which it reflected some of the pressures that are actually on the actual participants from the community, from the actual community and voluntary sector, who were keen to do it, but unfortunately had to drop out on some occasions. So yeah, that's something I think going forward we need to be more mindful of. And I think just underlines again the importance of actually having different ways of delivering this so that people can take advantage of it in their own time, which e-learning was really ideal for that. Joe? Just to give you a couple of perspectives from the tutor point of view, I said we had 7 of us that actually delivered. Overall, the program that was developed was viewed very positively by the trainers, who, as I said, had various experiences and what have you. We provided program scripts and notes, but we didn't do that in such a way that was prescriptive. So we did allow those trainers to and acknowledge and respect their own experiences and styles and what have you. So we gave them a base, if you like, of which to actually have training materials to utilize, which they adapted accordingly. Because of the fact that we probably didn't hit the numbers that, if you like, the number of people we got on board to be tutors, and there was a bit of disappointment for some tutors, the fact that they really wanted to do more of the delivery. I think that underlines the fact that they enjoyed doing that they did and wanted more, but obviously we could only cut our cloth accordingly in terms of the number of people who actually attended. The feedback from the face-to-face and online delivery was very, very positive, very, very good. And I'd go as far as to say we had exceptional praise for the tutors, the content, and the material. But as I say, you know, in some cases the trainers were disappointed that they had made a lot of commitment to do the work, but you know, perhaps didn't get the sort of number of sessions that they hoped they would do. But we'll see where that goes in the future. Next one, Joe. So comments from the actual participants. People were attracted to the program by the content and the actual, you know, to inform current and future roles. So those that came on it were not only those who were actually doing some community delivering already very clearly, but also those who wanted to do more and, you know, get on that sort of vein of leading a particular issue in their given communities of geography or interest or whatever. So some of them, it was good preparation for what they intended to do going forward. As I said, we had extremely positive feedback on the program, not just from the tutors, but very much importantly from the participants. What I think we can say from this is that once people got on the program, they were really, really positive about it. And we've done there's a video, isn't there, Joe, about, you know, showing the participants. And if you watch it, if you get a chance to watch that, it's actually on our BVSC website, that video. You get a great vibe from the actual session and the enthusiasm. And, you know, it's always useful to enjoy what you're doing when you're training. And I think, you know, there's very much a sense of that. We had some great feedback from people. I think the great byproduct from it was the way in which people who'd never met each other before were able to actually talk to each other about issues that they were facing in some of the work they were doing in communities. And, you know, when you watch the video, you'd think some of those people were people who knew each other for ages, the way in which they just gelled so well and got a lot of positive comments and support from each other. It wasn't just simply the material we provided, but they were, you know, applying what we were talking about from a theoretical point of view, and then sharing that. And there was also connections that were made between people who never knew each other before, post the training session as well. So, you know, that's examples of some of the very positive elements of the program that came about, really. Yes, so there's some neutral comments about the venue. We did do the training at the BVSC training room, but I think for the numbers that we eventually got, I think it did really satisfy and what have you. And there's a comment. It's a fantastic starting point for me as a leader. I have worked in many organizations. I think every manager would benefit from this course. So a real sort of, you know, positive recommendation and comment from there, you can see from one of the participants. Thanks, Joe. So just to talk a little bit more about the e-learning element of it, again, in terms of the feedback we've had so far, we've had excellent or reference to excellent content and easy to understand, really good examples to illustrate the training themes. There was one person who thought that we could do more in terms of problems with the registering, but eventually sorted that out. So yeah, there were times in which some of the sort of technological side of it sort of needed a little bit of further work, but you know, we've addressed that, and we were able to, I think, respond pretty quickly when there were issues with somebody actually getting on the course, or where they got stuck technically, you know, with some of the sort of technology and what have you. Some people, or one person, thought that the navigation around the course could be easier. We obviously got feedback as we were going through the program, and we're mindful of that feedback and how that would help us with the continuous improvement of the program. So again, you know, we'll take cognizance of comments like that around things like the navigability of the program and try and address it as we're going along and all the time. They found the animation that helped to deliver the learning. Colours and designs were well thought through, and for the issues of some access issues, the whole bit of colours and design is important in order to ensure that people can properly access the program. So I think, by and large, we've got that right. Didn't know what to expect, was pleasantly surprised, and very much the comment that they feel this has got great potential for the sector, and could be developed further into a wider suite of learning for the sector, which we're obviously looking at in terms of going forward. Thanks, Joe. Again, just to highlight some of the issues, the take-up, as I said earlier on, because it was free, I think actually in one sense worked against us when people dropped out. If we was to be honest, I think if it wasn't free, I think the ability to drop out would probably not been as high, and what have you. So take up of free training was below what was actually expected, and based on previous experience of things that we've done similar. But again, what we're hoping through things like this webinar, people know about it more. We're continuing advertising it through the BVSC website, and through other social media, so that it's out there. But of course, the best recommendation of the program is individuals who've gone on the program themselves, and that we've found. And certainly, many people afterwards were sort of saying, is this going to be running again? Because my friend or colleague would really like to come on it, and so on. So as a show later on, we are going to do a few more sessions. Feedback suggested that committing to 2 consecutive days or even 2 days in different weeks was difficult for some people. We've thought about that going into the courses we're going to run between now and the end of this year, which I'll go on to in a moment. So again, just trying to make it more accessible. Online training had a higher dropout rate than the in-person training. Again, 4 sessions was seen as being difficult to commit to sometimes. There was delays in the e-learning course that we put together. It took us a bit longer to actually get that right, but it was important to get it right, rather than getting something out there that then had all sorts of problems, and then finding that people were turned off from that. So it took us a little longer to get out there than we really wanted with the e-learning. But I think in the end, that time we took to get it right, I think has been worth doing. The e-learning program took several attempts to iron out, as I said, but I think by the time we launched and we did a two-way launch, I think we had got it right by that time. Take-up of the e-learning has been slower than anticipated, even though the web pages have attracted significant traffic. Thank you. In-person training and e-learning were more effective modes of delivery, and I think even though we did try and do all sorts of different bespoke versions of it, or I think in the end the 2-day program was in face-to-face learning was what was really more attractive to people, I think. We're actually taking on board comments, as I said earlier on, and the lower than anticipated bookings. It's worth trialing, I think, a 1-day course, which is what we're going to do, with the idea that we then back that up with the actual self-learning through the e-learning. So what we're going to be doing in future is a bit more of a blended learning approach to it all, starting with a 1-day, as I'll show in a moment, and then following that with the other modules through an e-learning approach. Yes, there's, as I said, we could do with a bit more refinement and around the functionality, and again, we'll be looking to actually do that, but still it's a valuable tool, and we believe it's got a longer life than the contract, and we're going to be going on with this well into next year as well. With the program, BVSC are willing and have agreed to invest in maintaining the content and the materials, and routinely providing training beyond the life of the project. And we'll also consider further development of the e-learning or of other modules that might be relevant that people have suggested, as well as, of course, the other thing that people said is about accreditation of the program. So again, that's something we're going to look at in the future in terms of accrediting the program. You, Joe? So we are going to run 3, not 2, but 3 1-day courses. They're going to be delivered in November and December, and I'll give you the dates in a moment. We'll continue to promote the e-learning. without doubt, I think there's more that people, I think, can access that program as and when it's suitable for them. And the idea of developing a sustainability plan, which would include, as I say, the business of accrediting the program. Next one. So just to confirm then, we will be running 3 one-day sessions. They will be on the 8th and 22nd of November, Wednesday the 8th and Wednesday the 22nd of November, and also Monday the 11th of December. They will run from 9:30 a.m. to 4 o'clock in the afternoon. They will be at the BVSC training room on at Livery House on Livery Street. And we've already had that out there and advertising it. As I say, it'll be a blended approach. The one day will then be followed up and will enable the participants to then access the other 7 modules via the e-learning platform. So just to give you a flavour of those modules, so we're absolutely clear. As I said, the first one is on champions and leadership, where we look at that in a lot of detail, and that'll be the first day. The back end of that first day will actually be showing people and enabling people to get onto the online platform. Once they're on the online platform, they'll be able to do the modules 2 to 8. That is community organising, what is it and how to do it effectively, working together, building effective teams and relationships and partnerships and networks, the power of storytelling, the importance of case studies and how to develop them. Next one, Joe. Power dynamics, understanding power dynamics within groups of people and how to understand and use that to your best advantage. Developing campaigns, making plans and putting them into practice. Negotiating skills, how to negotiate, compromise and achieve goals. And then the final module, which is communicating effectively and using different channels for different people in different situations. So that's the content of the program that's been so far. And just to underline again, we're going to be doing this blended approach on the dates that I've just given you. And if you want to get on the program, you go on to BVSC, you will actually see the details there and can actually get onto it via the SurveyMonkey link that's there, and so on. But if you want to, contact me directly, my email address is rayw@bvsc.org. So again, you can contact me directly if you want to speak to me about it. I do believe that this program has got further legs. I think it's gone down well. I think there are things that we can still do to actually, make it even better. I think the accreditation is something we will definitely look at. And again, I'm sure when we do the actual sessions in November and December, we'll get some further pointers that we'll take cognizance of and try and develop the program based on those comments as well. I think that's my last slide, Joe.
Yeah, right. Thank you very much. I'm just going to stop screen sharing now. Great. So after the webinar, we will be sharing the links. We can share the links for the video as well, that gives a brief overview of the community leadership training, includes me and Ray in that one as well. And we can share a link of how to access and how to sign up. I just want to leave it open at this stage. If anybody's got any questions or anything that we can support with them around community leading, whether that's Ray and the community leadership training or anything from the communities team, public health division can pick up. So yeah, I'll leave it open. If anyone's got anything, just jump in now. Okay, I'm going to take that as a no. I think we're okay. I've just popped the communities team email into the chat. So if anybody ever wants to get into contact with public health, if everyone ever needs anything mapped out or a connection to someone in public health, then please get into that touch into touch with that communities team email. We also do have a mailing list as well, where we share upcoming events or upcoming tender opportunities for community organisations. So if anybody wants to be added to the mailing list, please follow up with the communities team mailing list, and I will send through some information about today. Can send through a copy of the slides, but also send through the information on how to sign up and access the training. Brilliant. I think I'll close it there. Thank you very much, everyone, for attending. Thanks, Ray, for the presentation. That was really helpful to see the success of the training and to see what else is still available for people as well. And yeah, please get in touch with us if you want to access it.
I can see people are typing. You might want to give them a few minutes to type a few things.
Yeah,
so capture,
I'll do that.
and what have you. I mean, just the other thing, probably just to say, and probably didn't make enough of, is that, you know, we did work with a number of other partners. You saw the reference to Sports Birmingham. You know, there are organisations out there who shared our mission, and if you like, around, you know, there was similarities of what we were trying to do with what they were doing. And Sports Birmingham being a very good example of that. And so what we were able to do was to actually do some of the delivery out at Sports Birmingham with an existing known group of people who were endeavouring to become leaders around sport in their communities. Similarly, again, we had one individual I can think of who was working for Diabetes UK, and they were very much on a mission to sort of, you know, look at and share information and get out there and champion the issue around diabetes and so on. So anybody who's got a known group of people, you know, and you think we could come out to, I think that's something that we'd be willing to sort of talk to you further about that.
Ray, we've got a couple of questions in the
chat.
So one around from Lara: is this only available within Birmingham?
Well, we had to follow the tenders, obviously, for Birmingham community, and that means people who are working and living in Birmingham. So it's possible that somebody might live outside Birmingham, but you know, working in Birmingham, and they were obviously eligible to actually come on the programme.
Yeah, perfect. And I think, like, there's no restriction in terms of the online learning either, is there? So if people are working in Birmingham, they can access it, but I'm happy for that to be used wider. So thanks, Lara. And we've got another question there: was there a particular session or topic that was popular?
I think it's you know, the first session, the first module, really sets the scene really on sort of champions and leaders, and it's the longest and probably heavier bits of the program in terms of content. But in all honesty, all the modules went down really well, because I think all of them touched a vein, you know, with everybody who participated. But you know, I think the first one in particular, you know, was particularly strong. But I think all of them went down very well.
Yeah, I think that's something that we like to reiterate. Anyone who's accessed it has really enjoyed the program and has been very complimentary of it. So the main thing for us is just getting more people through the program, and whether that's the one-day sessions that Ray will be delivering later this year, or whether that's people accessing the online learning. I think we're very confident that the resource is good and that all the module materials are really helpful. It's just spreading the word and getting more people aware, and getting more people using the training, whether that's the in-person or online learning as well. Can just see some more typing in there, so I might just wait another little bit for a question. Also, feel free to come off mute. I can see a hand raised there, so feel free to ask it over here instead of on the chat as well.
Yeah, I got tired of typing. I just wanted to know, in terms of like gender breakdown or age breakdown, if you saw who was most likely to attend the sessions.
Yeah, what I'll do actually as a follow-up, I'll give you some very more precise figures, but without doubt it was predominantly female. Without doubt we had more than 50% representation from people I would identify as Black, ethnic minority communities, although clearly what we've done, just to be more precise than that, is we have collected data around issues of gender identity, etc. And what I should say, of course, is that there's going to be a written report. You know, so that will have all the details in there. But I think we're fairly satisfied that this was a program that actually had quite a diversity of involvement, and indeed involvement, as was said earlier on, in terms of and meeting the needs around the Black Year sort of agenda as well, but certainly issues around certainly gender and yeah.
Thank you.
Perfect. Great question. Thank you. And yeah, the report will be following later this year. Now that everyone's accessed this for Eventbrite, I think we'll permanently have it, have the attendees of this webinar, so we can share that out for everyone who's attended the webinar. People can see the evaluation when that comes out later this year. Perfect. I'm going to presume there's no more hands. I can see some more typing. Again, if you want to come off mute and talk, that's absolutely fine.
Sorry,
perfect.
That's me.
Thank you at the end of the session. Brilliant. I'll close it here then. As I said, any follow up at all, you've got my email, you've got Ray's email. There'll be some more material following the webinar. And thank you everyone for your time. We both hope that you found it useful and informative. Just going to stop the recording.
Okay.